Part 1. Prefixes. Question 1. The word element that comes before the word root and modifies its meaning is called a suffix, b prefix, c combining vowel, d combining form. Correct answer, B. Knowledge point explanation. Word structure. Most medical terms are composed of prefixes, word roots, and suffixes. A prefix is always found at the beginning of a word and typically provides information about location, time, or number. Clinical example. In the word preoperative, pre- is the prefix meaning before. Question 2. The functional center of a medical term that provides its basic meaning is the a prefix, b suffix, c word root, d combining vowel. Correct answer, C. Knowledge point explanation. Core meaning. The word root is the essential part of any medical term. It often refers to a specific body part or system. Universal foundation. Every medical term must contain at least one word root, even if it does not have a prefix or suffix. Question 3. When a suffix begins with a consonant, which of the following is used to connect it to the word root? A. Another suffix. B. A prefix. C. A combining vowel. D. A hyphen. Correct answer, C. Knowledge point explanation. Combining vowels. A combining vowel, usually the letter O, is used to make the term easier to pronounce. It is placed between the word root and the suffix if the suffix starts with a consonant. Combining form. The combination of a word root and a combining vowel is referred to as a combining form, e.g., gastro/o. Question 4. The medical suffix itis indicates which of the following conditions? A. Pain. B. Surgical removal. C. Inflammation. D. Disease. Correct answer, C. Knowledge point explanation. Common suffixes. Suffixes are added to the end of a word root to change or specify its meaning. The suffix itis is one of the most common terms SP technicians encounter. Application. For example, gastritis refers to inflammation of the stomach. Gastro equals stomach plus itis equals inflammation. Question 5. Which part of a medical term is usually added to the end of a word root to describe a procedure, condition, or disease? A. Prefix. B. Combining vowel. C. Suffix. D. Word root. Correct answer, C. Knowledge point explanation. Defining the condition. While the root provides the what, the body part, the suffix provides the what happened or what is being done. SP relevance. Understanding suffixes like ectomy, surgical removal, or scopy, visual examination, helps technicians identify the complexity of the instruments needed for a case. Question 6. Which of the following word roots refers to the heart? A. Gastro. B. Cardio. C. Nephro. D. Osteo. Correct answer, B. Knowledge point explanation. Word root identification. In medical terminology, the word root cardio is derived from the Greek word cardia, meaning heart. Application in SPD. SP technicians might see this in terms like cardiovascular, pertaining to the heart and blood vessels, or cardiogram, a record of heart activity. Question 7. The prefix hypo- means A. Above or excessive. B. Below or deficient. C. Within or inside. D. Around or surrounding. Correct answer, B. Knowledge point explanation. Prefix meanings. Prefixes often describe a quantitative or positional relationship. Hypo- is the opposite of hyper-. Clinical relevance. A common term is hypodermic, which literally means below the skin. Hypo equals below plus dermic equals skin. Question 8. Which suffix is used to describe a surgical opening created to allow the passage of stool or urine? A. Ectomy. B. Otomy. C. Ostomy. D. Pexy. Correct answer, C. Knowledge point explanation. Surgical suffixes. It is vital for SP technicians to distinguish between otomy, making an incision, and ostomy, creating a lasting opening. Example, a colostomy is a surgical procedure that creates an opening for the colon through the abdomen. Question 9. The word root encephalo refers to which organ? A. Liver. B. Brain. C. Lungs. D. Bladder. Correct answer, B. Knowledge point explanation. Organ-specific roots. Encephalo refers specifically to the brain. Hepat/O refers to the liver, and pneumo refers to the lungs. Equipment connection. Instruments used in encephalography are delicate neurological tools that require specialized handling in the SPD. Question 10. What does the prefix inter- mean? A. Within. B. Between. C. Fast. D. Under. Correct answer, B. Knowledge point explanation. Positional prefixes. Inter- is frequently confused with inter-, which means within. Inter- means between two different things. Practical example. Intercostal means between the ribs, inter equals between plus costal equals ribs. Question 11. Which of the following terms refers to the surgical removal of the uterus? A. Hysterectomy. B. Gastrectomy. C. Hysterotomy. D. Anerectomy. Correct answer, A. Knowledge point explanation. Word roots. Hyster/O is the word root for uterus, womb. Suffixes. The suffix ectomy means surgical removal. SPD importance. SP technicians must recognize these terms to ensure the correct specialized instrument sets, like major lap sets or hysterectomy clamps, are prepared. Question 12. The word root arthro refers to which part of the body? A. Bone. B. Joint. C. A muscle. D. Cartilage. Correct answer, B. Knowledge point explanation. Anatomy terminology. Arthro comes from the Greek word for joint. Clinical combining. It is commonly combined with scopy, arthroscopy, to describe the visual examination of a joint using an endoscope. Question 13. The word root nepher/O or run/O refers to which organ system? A. Respiratory system. B. Urinary system, kidneys. C. A nervous system. D. A digestive system. Correct answer, B. Knowledge point explanation. Dual terminology. In medical terms, nepher/O, Greek, and run/O, Latin, both refer to the kidneys. Practical application. A nephrectomy is the surgical removal of a kidney. Knowing this helps an SP technician anticipate the need for a major kidney tray or specialized vascular instruments. Question 14. The prefix peri- means A. Within. B. Around or surrounding. C. Beside. D. Through. Correct answer, B. Knowledge point explanation. Positional prefixes. Peri- describes something that surrounds a structure. It is a common prefix in surgical procedures. Surgical example. Perioperative refers to the entire period surrounding a surgical procedure, including preoperative, intraoperative, and postoperative phases. Question 15. The word root ost/O is used to describe which of the following? A. Muscle. B. Bone. C. A nerve. D. A skin. Correct answer, B. Knowledge point explanation. Musculoskeletal roots. Ost/O refers to bones. It is the foundation for terms in orthopedic surgery. Instrument association. When you see osteo on a set label, like an osteotome, you know the instrument is designed to cut or shape bone. Question 16. The prefix erythro- is used to describe which color? A. White. B. Red. C. Blue. D. Yellow. Correct answer, B. Knowledge point explanation. Color prefixes. Erythro- comes from the Greek word for red. It is most commonly seen in erythrocytes, which are red blood cells. Clinical relevance. Understanding color-related prefixes helps technicians understand physiological conditions or the types of cells being discussed in medical reports. Question 17. Which prefix indicates that a condition or structure involves both sides of the body? A. Uni-. B. Bi-. C. Multi-. D. Semi-. Correct answer, B. Knowledge point explanation. Numerical prefixes, bi- means two or double. In a surgical context, bilateral means relating to both the right and left sides of the body. SPD application. If a surgery is bilateral, the SP technician knows they must provide two of the same instrument sets or double the supplies for that case. Question 18. The suffix AAMI refers to which type of surgical action? A. Surgical removal. B. To create a permanent opening. C. To cut into or make an incision. D. Surgical repair. Correct answer, C. Knowledge point explanation. Surgical action suffixes. It is essential to distinguish between otomy, incision into, and ectomy, removal of. For example, a laparotomy is an incision into the abdominal cavity. Technician's role. Knowing the difference helps in understanding the level of invasiveness and the types of retractors and cutting instruments required. Question 19. Which of the following prefixes means within or inside? A. Extra dash. B. Inter dash. C. Inter dash. D. Peri dash. Correct answer, B. Knowledge point explanation. Directional prefixes. Inter dash is a very common prefix in sterile processing. For example, intravenous, means within a vein. Potential confusion. Technicians must be careful not to confuse inter dash, within, with inter dash, between. Question 20. The word root leuco refers to which color? A. Black. B. Green. C. White. D. Purple. Correct answer, C. Knowledge point explanation. Blood cell terminology. Leuco- refers to white. Leukocytes are white blood cells, which are part of the body's immune system to fight infection. Significance in SPD. High counts of leukocytes in a patient's history may indicate an active infection, emphasizing the need for strict adherence to decontamination protocols for instruments used on that patient. Question 21. The suffix pexy refers to which type of surgical procedure? A. Surgical repair. B. Surgical fixation. C. Surgical removal. D. To create an opening. Correct answer, B. Knowledge point explanation. Surgical fixation. The suffix pexy means to fixate or attach a structure that has become displaced or sagged. Clinical example. An orchiopexy is a surgery to move an undescended testicle into the scrotum and permanently fix it there. Question 22. Which directional term describes a structure that is closer to the point of attachment to the body? A. Distal. B. Proximal. C. Medial. D. Lateral. Correct answer, B. Knowledge point explanation. Anatomical position. Proximal refers to being closer to the trunk of the body or the point of origin of a part. Application in SPD. When inspecting long instruments or endoscopes, a technician might describe damage as being on the proximal end, the end held by the surgeon, or the distal end, the working end inside the patient. Question 23. The prefix para- is used to describe something that is A. Across or through. B. Beside or near. C. Against or opposite. D. Within or inside. Correct answer, B. Knowledge point explanation. Positional prefix. Para- indicates a position alongside or near a specific structure. Example, parathyroid glands are small glands located beside the thyroid gland. Question 24. The suffix plasty refers to A. Surgical repair or reconstruction. B. Surgical removal. C. Surgical incision. D. Visual examination. Correct answer, A. Knowledge point explanation. Reconstructive suffix. Plasty is used for procedures that involve reshaping or repairing a body part. SPD connection. A rhinoplasty, nose repair/reshaping, or arthroplasty, joint replacement/repair, requires specific sets of delicate or heavy-duty orthopedic instruments. Question 25. Which of the following directional terms means toward the side of the body, away from the midline? A. Medial. B. Lateral. C. Superior. D. Inferior. Correct answer, B. Knowledge point explanation. Midline relationship. The midline is an imaginary line dividing the body into left and right halves. Lateral is away from this line, while medial is toward it. Question 26. Which anatomical plane divides the body into equal right and left halves? A. Transverse plane. B. Sagittal plane. C. Mid-sagittal plane. D. Frontal plane. Correct answer, C. Knowledge point explanation. Body planes. Planes are imaginary lines used to divide the body for anatomical description. Mid-sagittal versus sagittal. A sagittal plane divides the body into right and left portions, but the mid-sagittal plane specifically passes through the midline, creating two equal halves. Question 27. The abdominal cavity is often divided into how many quadrants for clinical description? A. 2 quadrants. B. 4 quadrants. C. 6 quadrants. D. 9 quadrants. Correct answer, B. Knowledge point explanation. Abdominal quadrants. Clinicians use a simple 4-quadrant system, right upper, right lower, left lower, to pinpoint the location of pain or a surgical site. Clinical relevance. Knowing the quadrant helps the SP technician anticipate which specialty instruments might be needed, e.g., gallbladder instruments are typically used in the right upper quadrant. Question 28. Which term describes a position toward the back of the body? A. Anterior. B. Posterior. C. Ventral. D. Deep. Correct answer, B. Knowledge point explanation. Anterior and posterior. Anterior, or ventral, refers to the front, while posterior, or dorsal, refers to the back. Part 2. Suffixes. Question 1. Which of the following suffixes refers to the surgical removal of a body part? A. Otomy. B. Ectomy. C. Ostomy. D. Pexy. Correct answer, B. Knowledge point explanation. Surgical removal. The suffix ectomy specifically means the surgical removal or excision of an organ or tissue. This is a primary term in the sterile processing department for identifying sets. Question 2. The medical suffix itis is used to describe which of the following conditions? A. Tumor. B. Inflammation. C. Pain. D. Softening. Correct answer, B. Knowledge point explanation. Inflammation. This suffix is added to a word root to indicate inflammation of that specific body part, such as arthritis or dermatitis. Question 3. If a technician sees the suffix scopy on a surgical schedule, what type of procedure is expected? A. Surgical repair. B. Visual examination. C. A record or image. D. Surgical puncture. Correct answer, B. Knowledge point explanation. Visual examination. This suffix refers to the process of using a specialized instrument, like an endoscope, to view the inside of an organ or cavity. Question 4. Which suffix would be used to describe the surgical restoration or repair of a body part? A. Otomy. B. Aplasty. C. Rapey. D. Atripsy. Correct answer, B. Knowledge point explanation. Surgical repair. The suffix plasty is used for reconstructive procedures aimed at restoring function or appearance, such as arthroplasty. Question 5. The suffix oma refers to which of the following? A. Disease. B. Tumor or neoplasm. C. Enlargement. D. Hardening. Correct answer, B. Knowledge point explanation. Tumor. This suffix is used in pathology to denote a mass, growth, or tumor, which can be benign or malignant. Question 6. When a surgeon creates a new permanent opening in an organ, the procedure ends with the suffix A. Otomy. B. Ostomy. C. Ectomy. D. Pexy. Correct answer, B. Knowledge point explanation. Permanent opening. The suffix ostomy describes the creation of an artificial opening or stoma between two organs or to the body surface. Question 7. Which suffix refers to a surgical puncture to remove fluid? A. Centesis. B. Graphy. C. Tripsy. D. Amalacia. Correct answer, A. Knowledge point explanation. Surgical puncture. This involves inserting a needle into a body cavity to aspirate fluid for diagnostic or therapeutic purposes. Question 8. The suffix gram indicates which of the following? A. An instrument used to record. B. A record or image. C. The process of recording. D. Pain. Correct answer, B. Knowledge point explanation. Record or image. This suffix refers to the actual diagnostic result, such as an X-ray film or a printed tracing. Question 9. If a surgeon is performing a lithotripsy, what is the meaning of the suffix tripsy? A. To remove. B. To crush. C. To view. D. To stitch. Correct answer, B. Knowledge point explanation. To crush. This suffix specifically refers to the mechanical or intentional crushing of structures, usually stones or calculi. Question 10. Which suffix means narrowing or stricture? A. Stenosis. B. Sclerosis. C. Ptosis. D. Megaly. Correct answer, A. Knowledge point explanation. Narrowing. This pathological suffix describes the abnormal narrowing of a body passage, duct, or opening. Question 11. Which suffix refers to the process of recording or producing an image, such as an X-ray or a scan? A. Gram. B. Graphy. C. Graph. D. Scopy. Correct answer, B. Knowledge point explanation. Process of recording. While gram refers to the final result, the record itself, graphy refers to the actual process or technology used to create that record. Question 12. The pathological suffix malacia is used to describe which condition? A. Hardening. B. Softening. C. Enlargement. D. Narrowing. Correct answer, B. Knowledge point explanation. Abnormal softening. This suffix indicates that a tissue or organ has become abnormally soft, which can lead to functional issues. Question 13. Which of the following suffixes means enlargement? A. Stenosis. B. Ptosis. C. Megaly. D. Sclerosis. Correct answer, C. Knowledge point explanation. Enlargement. Megaly is added to word roots to describe the abnormal enlargement of an organ, such as cardiomegaly, enlarged heart. Question 14. The suffix rapy means which of the following? A. To cut into. B. To create an opening. C. To suture or stitch. D. To repair. Correct answer, C. Knowledge point explanation. Suturing. This suffix specifically refers to the act of suturing or stitching a structure together to repair it. Question 15. Which term describes the drooping or sagging of a body part? A. Ptosis. B. Stenosis. C. Sclerosis. D. Amalacia. Correct answer, A. Knowledge point explanation. Drooping. Ptosis is used when an organ or tissue sags from its normal position. Question 16. Which pathological suffix is used to describe the abnormal hardening of a tissue or structure? A. Malacia. B. Sclerosis. C. Stenosis. D. Itosis. Correct answer, B. Knowledge point explanation. Abnormal hardening. The suffix sclerosis refers to a condition where tissues become tough or hard, often due to inflammation or disease, such as in atherosclerosis. Question 17. The suffix algia is used in medical terminology to denote which of the following? A. Inflammation. B. Pain. C. A disease. D. A specialized study. Correct answer, B. Knowledge point explanation. Pain. This suffix is frequently seen in terms like fibromyalgia or neuralgia to indicate a painful condition in a specific area. Question 18. Which suffix describes an abnormal condition of stones or calculi within the body? A. Yashas. B. Lithiasis. C. Eosis. D. Apathy. Correct answer, B. Knowledge point explanation. Stone formation. The suffix lithiasis combines lith, stone, and yashas, condition, specifically referring to the presence of stones in organs like the gallbladder or kidneys. Question 19. The suffix pathy refers to which general medical concept? A. Treatment. B. Disease. C. Origin. D. Measurement. Correct answer, B. Knowledge point explanation. Disease. This is a very broad suffix used to indicate that a specific organ or system is diseased, such as in neuropathy, nerve disease. Question 20. Which of the following suffixes means a specialized field of study or science? A. Ist. B. Logi. C. Ishan. D. Iatry. Correct answer, B. Knowledge point explanation. Study of. The suffix logi indicates a branch of learning or science, such as biology or cardiology. Part 3. Roots. Question 1. Which of the following word roots refers to the heart? A. Gastro. B. Cardio. C. Nephro. D. Osteo. Correct answer, B. Knowledge point explanation. Heart root. In medical terminology, the word root cardio is derived from the Greek word cardia, meaning heart. It is the foundation for terms like cardiology, the study of the heart. Question 2. The word root gastro refers to which organ? A. Liver. B. Brain. C. Stomach. D. Lung. Correct answer, C. Knowledge point explanation. Stomach root. Gastro refers to the stomach. For an SP technician, seeing this root on an instrument set, like a gastroscope, indicates it is used for the digestive system. Question 3. Which word root refers specifically to the brain? A. Encephalo. B. Rhino. C. Cysto. D. Emio. Correct answer, A. Knowledge point explanation. Brain root. Encephalo refers to the brain. This is a critical root for neurosurgical instrumentation. Question for the word root nephro refers to which organ? A. Nerve. B. Kidney. C. A joint. D. A skin. Correct answer, B. Knowledge point explanation. Kidney root, nephro, Greek, and run, Latin, both refer to the kidney. Question 5. Which root is used to describe the liver? A. Pneumo. B. A hepat/oacechol. D. A hystero. Correct answer, B. Knowledge point explanation. Liver root, hepat/o is the root for the liver. An example is hepatitis, inflammation of the liver. Question 6. The word root ost/o refers to which of the following? A. Muscle. B. Bone. C. Cartilage. D. Blood. Correct answer, B. Knowledge point explanation. Bone root, ost/o refers to bones. Orthopedic surgery sets are filled with instruments starting with this root, such as an osteotome. Question 7. Which word root refers to the lungs or air? A. Derm. B. Pneumo. C. Oculo. D. Oro. Correct answer, B. Knowledge point explanation. Lung root, pneumo refers to the lungs, air, or gas. Question 8. The word root /o refers to which body part? A. Nerve. B. Muscle. C. A joint. D. A ligament. Correct answer, C. Knowledge point explanation. Joint root, /o refers to joints. For example, arthroplasty is the surgical repair or replacement of a joint. Question 9. Which word root refers to the bladder? A. Cysto. B. Colorado. C. Entero. D. Procto. Correct answer, A. Knowledge point explanation. Bladder root, cysto refers to the bladder or a fluid-filled sac. Question 10. The word root myo refers to which tissue? A. Nerve. B. A skin. C. A muscle. D. A fat. Correct answer, C. Knowledge point explanation. Muscle root, myo refers to muscle tissue. Question 11. Which word root refers to the nose? A. Rhino. B. Oto. C. Ophthalmo. D. Stomato. Correct answer, A. Knowledge point explanation. Nose root, rhino refers to the nose. A common surgical procedure is a rhinoplasty, which is the surgical repair or reshaping of the nose. Question 12. The word root oto refers to which sensory organ? A. Eye. B. Ear. C. A tongue. D. A nose. Correct answer, B. Knowledge point explanation. Ear root, oto refers to the ear. In the SPD, you will see oto on specialized ear instrument sets used for procedures like a myringotomy. Question 13. Which word root is used to describe the skin? A. Myo. B. Neuro. C. Derm. D. Angio. Correct answer, C. Knowledge point explanation. Skin root, derm refers to the skin. Dermatitis means inflammation of the skin. Question 14. The word root angio refers to which of the following? A. Nerve. B. A vessel. C. A gland. D. A joint. Correct answer, B. Knowledge point explanation. Vessel root, angio refers to a vessel, usually a blood vessel. An angiogram is an X-ray or image of the blood vessels. Question 15. Which word root refers to the brain or the head? A. Encephalo. B. Rhino. C. Thoraco. D. Abdomino. Correct answer, A. Knowledge point explanation. Brain root, as we discussed earlier, encephalo refers to the brain. Instruments used for brain surgery are found in craniotomy or neurology sets. Question 16. The word root hystero refers to which female reproductive organ? A. Ovary. B. Uterus. C. Vagina. D. Fallopian tube. Correct answer, B. Knowledge point explanation. Uterus root, hystero refers to the uterus, womb. A hysterectomy is the surgical removal of the uterus. Question 17. Which word root refers to the small intestine? A. Colorado. B. Entero. C. Gastro. D. Esophago. Correct answer, B. Knowledge point explanation. Small intestine root, entero refers to the small intestine. Gastroenteritis is inflammation of the stomach and small intestine. Question 18. The word root chol refers to which substance or organ system? A. Urine. B. Bile. C. Blood. D. A lymph. Correct answer, B. Knowledge point explanation. Bile root, chol refers to bile or the gallbladder. A common procedure is a cholecystectomy, the removal of the gallbladder. Question 19. Which word root refers to the nerves? A. Myo. B. Neuro. C. Osteo. D. Arth/O. Correct answer, B. Knowledge point explanation. Nerve root, neuro refers to the nerves or the nervous system. Question 20. The word root thoraco refers to which area of the body? A. Abdomen. B. Chest. C. Pelvis. D. Back. Correct answer, B. Knowledge point explanation. Chest root, thoraco refers to the chest, thorax. A thoracotomy is a surgical incision into the chest wall. Question 21. Which word root refers to the gallbladder? A. Hepat/O. B. Cholecyst/O. C. Nephr/O. D. Splen/O. Correct answer, B. Knowledge point explanation. Gallbladder root, cholecyst/O is a compound root, chole, bile, plus cyst, sac. In the SPD, one of the most common procedures you will see is a cholecystectomy, gallbladder removal. Question 22. The word root colo refers to which part of the digestive system? A. Stomach. B. Small intestine. C. Colon or large intestine. D. Rectum. Correct answer, C. Knowledge point explanation. Colon root, colo refers to the colon or large intestine. Colostomy is a common procedure where an opening is created in the colon. Question 23. Which word root is used to describe the skull? A. Ost/O. B. Cranio. C. Encephalo. D. A vertebro. Correct answer, B. Knowledge point explanation. Skull root, cranio refers to the skull. A craniotomy is a surgical opening into the skull, which requires highly specialized neurosurgical power tools and instrument sets. Question 24. The word root hystero refers to the uterus. Which other root can also refer to the uterus? A. Salpingo. B. Oaphoro. C. Metro. D. Tecalpo. Correct answer, C. Knowledge point explanation. Uterus roots, both hystero and metro refer to the uterus. You might see endometritis, which is inflammation of the inner lining of the uterus. Question 25. Which word root refers to the blood vessels? A. Cardio. B. Vaso or angio. C. Neuro. D. Emio. Correct answer, B. Knowledge point explanation. Vessel roots, both vaso and angio refer to vessels. SP technicians handle vascular clamps and shunts specifically designed for these procedures. Question 26. The medical term gastroscopy refers to the visual examination of which organ? A. Liver. B. Stomach. C. Colon. D. Bladder. Correct answer, B. Knowledge point explanation. Word breakdown. This term combines the word root gastro, stomach, with the suffix scopy, visual examination. In the SPD, this helps technicians identify that a gastroscope is the required instrument. Question 27. What is the meaning of the term arthroplasty? A. Inflammation of a joint. B. Surgical repair or replacement of a joint. C. Visual examination of a joint. D. Incision into a joint. Correct answer, B. Knowledge point explanation. Combining forms, arthro, joint, combined with plasty, surgical repair, describes reconstructive joint surgery. These procedures require heavy-duty orthopedic instrument sets. Question 28. The term nephrectomy describes which surgical action? A. Surgical removal of a kidney. B. Incision into a kidney. C. Creation of an opening in a kidney. D. Inflammation of a kidney. Correct answer, A. Knowledge point explanation. Organ and action. By identifying the root nephro, kidney, and the suffix ectomy, removal, the technician knows that a major organ is being removed and must prepare the appropriate vascular and tissue instruments. Question 29. What condition is described by the term myalgia? A. Muscle weakness. B. Muscle pain. C. Muscle inflammation. D. Muscle wasting. Correct answer, B. Knowledge point explanation. Symptom roots, myo, muscle, combined with the suffix algia, pain, results in the term for muscle pain. Understanding symptoms helps technicians understand the clinical context of the patient. Part 4, Abbreviations. Question 1. What does the surgical abbreviation ORIF stand for? A. Open reduction internal fixation. B. Orthopedic reconstruction internal fixation. C. Open repair internal fixation. D. Open reduction instrument fixation. Correct answer, A. Knowledge point explanation. ORIF meaning. This abbreviation stands for Open Reduction Internal Fixation. Open reduction means the surgeon makes an incision to align the bones, and internal fixation means the surgeon uses hardware like plates and screws to hold the bone in place. Question 2. The abbreviation BSO refers to which surgical procedure? A. Bilateral salpingo-oophorectomy. B. Bilateral stomach operation. C. Basic surgical opening. D. Bilateral salpingo-osteotomy. Correct answer, A. Knowledge point explanation. GYN abbreviation, BSO stands for bilateral salpingo-oophorectomy. This involves the removal of both fallopian tubes and both ovaries. In the SPD, this tells you to prepare specific gynecological instrument sets. Question 3. What does the abbreviation CABG stand for in cardiovascular surgery? A. Coronary artery bypass graft. B. Coronary artery blood graft. C. Cardiac artery bypass graft. D. Coronary abdominal bypass graft. Correct answer, A. Knowledge point explanation. Heart surgery, CABG stands for coronary artery bypass graft, commonly known as heart bypass surgery. This procedure requires highly specialized cardiovascular instrument sets and sternal saws. Question 4. In orthopedic surgery, what does the abbreviation THA stand for? A. Total hip arthroplasty. B. Total hip amputation. C. Total hand arthroplasty. D. Total hip abrasion. Correct answer, A. Knowledge point explanation. Joint replacement, THA stands for total hip arthroplasty, which is a full hip replacement. For an SP technician, this requires preparing a large amount of instrumentation, including reamers, trials, and implants. Question 5. The abbreviation BKA describes which procedure? A. Bone knee amputation. B. Below knee amputation. C. Basic knee arthroplasty. D. Below knee alignment. Correct answer, B. Knowledge point explanation. Amputation type, BKA stands for below knee amputation. Understanding whether an amputation is above the knee, aka, or below the knee, BKA, helps the technician provide the correct size of surgical drapes and instruments. Question 6. What is the full form of the medical abbreviation TAH? A. Total abdominal hysterectomy. B. Total abdominal hematoma. C. Technical abdominal hysterectomy. D. Total abdominal hepatectomy. Correct answer, A. Knowledge point explanation. TAH breakdown. TAH stands for total abdominal hysterectomy. This involves the removal of the entire uterus through an abdominal incision. In the SPD, this indicates a need for major laparotomy instrument sets and specific GYN retractors. Question 7. The abbreviation CR in orthopedic surgery refers to which of the following? A. Combined reduction. B. Closed reduction. C. Complete reconstruction. D. Chronic repair. Correct answer, B. Knowledge point explanation. Closed reduction. CR stands for closed reduction. Unlike ORIF, this procedure aligns a broken bone without making a surgical incision. It often requires C-arm imaging and lead aprons for the staff. Question 8. In the context of the abbreviation BSO, what does the S stand for? A. Stomach. B. Salpingo. C is spine. D is systemic. Correct answer, B. Knowledge point explanation. BSO components. BSO stands for bilateral salpingo-oophorectomy. The S stands for salpingo, which refers to the fallopian tubes. This is often performed alongside a hysterectomy. Question 9. What does the medical abbreviation ENT stand for in a surgical context? A. Ear, nose, throat. B. Eye, nose, tongue. C. External nerve treatment. D. Endoscopic nose therapy. Correct answer, A. Knowledge point explanation. ENT meaning. ENT refers to ear, nose, and throat surgery, also known as otolaryngology. SP technicians must be familiar with this abbreviation to provide the correct specialized microinstruments and scopes used in these delicate procedures. Question 10. The abbreviation TURP is commonly used in urology. What does it stand for? A. Transurethral resection of the prostate. B. Total urinary renal procedure. C. Transabdominal ureteral repair procedure. D. Total urethral resection of the prostate. Correct answer, A. Knowledge point explanation. Urology procedure, TURP stands for transurethral resection of the prostate. This is a common procedure that uses a resectoscope to remove prostate tissue through the urethra. Knowing this abbreviation helps the technician prepare the specific urology tower and endoscopic equipment required. Question 11. In the context of respiratory and thoracic health, what does the abbreviation COPD stand for? A. Chronic obstructive pulmonary disease. B. Common obstructive pulmonary disease. C. Chronic ossification pulmonary disease. D. Chronic obstructive pediatric disease. Correct answer, A. Knowledge point explanation. Medical condition. COPD stands for chronic obstructive pulmonary disease. While this is a medical condition rather than a specific surgery, seeing it in a patient's history is important for the surgical team and the SP technicians who process anesthesia equipment. Question 12. What does the abbreviation AV fistula stand for in vascular surgery? A. Arteriovenous fistula. B. Arterial vascular fistula. C. Atrioventricular fistula. D. Automated vascular fistula. Correct answer, A. Knowledge point explanation. Vascular access, AV fistula stands for arteriovenous fistula. This is a surgical connection made between an artery and a vein, typically for dialysis access. This procedure requires fine vascular suturing instruments and vascular clamps. Question 13. What is the meaning of the abbreviation PE tubes in pediatric ENT surgery? A. Pressure equalization tubes. B. Permanent ear tubes. C. Pediatric ear tubes. D. Pulmonary equalization tubes. Correct answer, A. Knowledge point explanation. ENT terminology. PE tubes stands for pressure equalization tubes. These are tiny tubes inserted into the eardrum during a myringotomy to allow air to enter the middle ear. These require extremely small microinstruments and ear speculums. Part 5. Definitions. Question 1. What is the purpose of a cholecystectomy? A. To repair the liver. B. To remove the gallbladder. C. To create an opening in the stomach. D. To visually examine the colon. Correct answer, B. Knowledge point explanation. Cholecystectomy purpose. A cholecystectomy is a surgical procedure performed to remove the gallbladder, typically due to gallstones or inflammation. In the SPD, this procedure requires laparoscopic instrument sets and clip pliers. Question 2. What is the primary goal of a hysterectomy? A. To remove the uterus. B. To repair the bladder. C. To remove an ovary. D. To examine the abdominal cavity. Correct answer, A. Knowledge point explanation. Hysterectomy definition. A hysterectomy is a surgical procedure to remove the uterus. Depending on the approach, SP technicians may need to prepare vaginal, abdominal, or robotic-assisted instrument sets. Question 3. What is the purpose of a prostatectomy? A. To repair the kidney. B. To remove the prostate gland. C. To remove the bladder. D. To create an opening in the ureter. Correct answer, B. Knowledge point explanation. Prostatectomy procedure. A prostatectomy is a procedure to remove the prostate gland, often to treat cancer or severe enlargement. This often involves specialized urological or robotic instrumentation. Question 4. According to the definitions, a pneumonectomy is a procedure to do what? A. To examine the chest cavity. B. To remove a lung. C. To repair the heart. D. To drain fluid from the chest. Correct answer, B. Knowledge point explanation. Lung removal. A pneumonectomy is the surgical procedure to remove a lung. This is distinct from a thoracoscopy, which is only a visual examination of the thoracic cavity. Question 5. What is the difference between a colostomy and a colectomy? A. A colostomy removes the colon, while a colectomy creates an opening. B. A colostomy creates an opening, while a colectomy removes part or all of the colon. C. Both procedures involve removing the gallbladder. D. Both procedures are used to examine the stomach. Correct answer, B. Knowledge point explanation. Bowel procedures. A colostomy is a procedure to create an opening in the colon, whereas a colectomy is a procedure to remove part or all of the colon. SP technicians must distinguish between these to ensure the correct collection bags or resection instruments are ready. Part 6. Terminology. Question 1. A surgical procedure to examine the thoracic cavity is called a what? A. Pneumonectomy. B. Thoracoscopy. C. Thoracotomy. D. A bronchoscopy. Correct answer, B. Knowledge point explanation. Visual examination. Thoracoscopy combines the root thoraco, chest, with the suffix scopy, visual examination. In the SPD, this indicates the use of rigid or flexible endoscopes to view the chest cavity. Question 2. The surgical procedure to remove a lung is called a what? A. Pneumonectomy. B. Thoracoscopy. C. A lobectomy. D. A pleurectomy. Correct answer, A. Knowledge point explanation. Organ removal. Pneumonectomy uses the root pneumo, lung/air, and the suffix ectomy, removal. This is a major surgical procedure requiring heavy-duty thoracic instrument sets and rib spreaders. Question 3. A surgical procedure to visually examine a joint is called a what? A. Arthroplasty. B. Arthroscopy. C. Arthrocentesis. D. Arthrotomy. Correct answer, B. Knowledge point explanation. Joint visualization. Arthroscopy involves using a camera, arthroscope, to look inside a joint. SP technicians must handle these scopes with extreme care as they are delicate and expensive. Question 4. A surgical procedure to visually examine organs of the abdomen is called a what? A. Laparotomy. B. Laparoscopy. C. Gastroscopy. D. Cystoscopy. Correct answer, B. Knowledge point explanation. Abdominal scope. Laparoscopy uses the root laparo, abdomen, and the suffix scopy. This is one of the most common minimally invasive procedures, requiring specific towers, cameras, and insufflation equipment. Question 5. A hysteroscopy is a procedure to visually examine the uterus, whereas a hysterectomy is a procedure to do what? A. To repair the uterus. B. To remove the uterus. C. To create an opening in the uterus. D. To examine the ovaries. Correct answer, B. Knowledge point explanation. Hystero-root application. Both terms use the root hystero, uterus, but the suffixes determine if the doctor is just looking, scopy, or performing a major removal, ectomy. Question 6. The surgical procedure to remove the gallbladder is called a cholecystectomy, but what would a visual examination of the same area be called? A. Cholecystotomy. B. Cholecystoscopy. C. Cholecystoscopy. D. A hepatoscopy. Correct answer, B. Knowledge point explanation. Terminology logic, using the root cholecysto, gallbladder, and adding scopy creates the term for visual examination. In practice, this might be part of a larger laparoscopic procedure. Question 7. If a patient undergoes an arthrocentesis, what is being done to the joint? A. Surgical repair. B. Surgical puncture to remove fluid. C. Complete replacement. D. Permanent fixation. Correct answer, B. Knowledge point explanation. Puncture suffix. The suffix centesis indicates a puncture, often to relieve pressure or for diagnostic testing of synovial fluid in a joint. Question 8. What term describes the surgical repair or restoration of a body part? A. Otomy. B. Aplasty. C. Oriphy. D. Ossus. Correct answer, B. Knowledge point explanation. Restoration. The suffix plasty is used when a structure is being reconstructed or reshaped to improve function or appearance. Question 9. Which of the following describes a surgical incision into a body part? A. Ectomy. B. Otomy. C. Ostomy. D. Scopy. Correct answer, B. Knowledge point explanation. Incision only. Otomy refers to a simple cut into a tissue or organ, often as an initial step before more complex work or for temporary drainage.